Hemophilia, a disorder in which blood does not clot normally. When blood can't clot properly, exclusive bleeding occurs after any injury or damage. Rare, fewer than 1 million cases per India. Treatment can help, but this condition can't be cured. It requires a medical diagnosis. Lab tests or imaging always required. Symptoms. Signs and symptoms of hemophilia vary depending on your level of clotting factors. If your clotting factor level is mildly reduced, you might bleed only after surgery or trauma. If your deficiency is severe, you can bleed easily for seemingly no reason. Signs and symptoms of spontaneous bleeding include unexplained and excessive bleeding from cuts or injuries or after surgery or dental work. Many large or deep bruises, unusual bleeding after vaccinations, pain, swelling or tightness in your joints, blood in your urine or stool, nose bleeds without any known cause. In infants, unexplained irritability, bleeding into the brain. A simple bump on the head can cause bleeding into the brain for some people who have severe hemophilia. This rarely happens, but it's one of the most serious complications that can occur. Signs and symptoms include painful prolonged headache, repeated vomiting, sleepiness or lethargy, double vision, sudden weakness or clumsiness, convulsions or seizures. Complication of hemophilia can include deep internal bleeding. Bleeding that occurs in deep muscle can cause the limbs to swell. The swelling can press on nerves and lead to numbness or pain, depending on where the bleeding occurs. It could be life-threatening. Bleeding into the throat or neck. This can affect a person's ability to breathe. Damage to joints. Internal bleeding can put pressure on the joints, causing severe pain. Left untreated, frequent internal bleeding can cause arthritis or destruction of the joint. Infection. If the clotting factors used to treat hemophilia come from human blood, there's an increased risk of viral infections such as hepatitis C. Because of donor screening techniques, the risk is low. Adverse reaction to clotting factor treatment. In some people with severe hemophilia, the immune system has a negative reaction to the clotting factors used to treat bleeding. When this happens, the immune system develops proteins that keep